With COVID-19 on the rise, hospitals and other organizations are leveraging technology to expand outreach to patients and communities. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer for AHA. In this podcast, Priya Bathija, Vice President of the AHA's The Value Initiative, speaks with Kaakpema Yelpaala, KP for short, founder and CEO of access.mobile. They're discussing using mobile technology to address health needs, especially during the COVID-19 pandemic.
Thank you, Tom, and thank you, KP, for joining us once again to discuss how Access Mobile is engaging patients and communities. This time around, we hope you can share with us how you're reconnecting with patients and communities during the COVID-19 pandemic. So I'll just get started with a few questions. When we spoke in December, you shared with us how hospitals can use mobile technology to improve access. And how can they do that during the COVID-19 pandemic?
Great. Thanks so much, Priya, for having me back to continue the conversation. I think, as you may recall, what we do at Access Mobile is we use mobile communication through both precision and cultural competency to reach people with critical information about linking with services and their overall care needs. And I think now with COVID-19 more than ever, whether it's a hospital or other healthcare organizations, critical need for clear and consistent communication to patients, because there's so much out there and a lot of people are trying to figure out what to do. And there was a study that came out recently by McKinsey that just talked about how people generally trust their providers and payers when it comes to healthcare information, and particularly in the COVID context. And so more than ever, mobile becomes a way to reach people through a tool that many people have and with critical information that's trusted.
And I know in past conversations, we've talked about some of the work that you're doing specifically in LA, which is a really big urban center, as well as rural Oregon. How has the work that you've been doing to help communicate with patients different now that we're in this COVID-19 world, and then really different between that urban and rural setting?
Right. So I think the first thing I can say is with all of our clients in the U.S., both urban and rural, we've seen a significant increase in messaging. So between February, like January, February, so kind of when COVID was really taking hold in the U.S. to April, we had an 8x increase in the number of messages that our clients were sending to the people they're responsible for in terms of their care needs. I think that's consistent with the theme that I was just describing, that there's so much confusion out there for a lot of patients about what to do, where to go, what information is valid and not valid. And I think our clients wanted to respond through the SMS channel specifically to reach people, to give them that critical information. With our client in Los Angeles, for example, they have a program for the elderly. They have a few thousand people in this program, which involved on-site get-togethers and then other types of linkages to services. And with COVID, the first thing that happened is those on-site meetings weren't happening, and that needed to be communicated in a way that was both time and cost efficient. So we supported the client in that. But then furthermore, with regards to SDOH, food insecurity has been a major challenge in our country. And this partner of ours in Los Angeles had stood up a program to offer food support to this elderly community. And so we sent out a follow-on message basically asking people via text whether or not they had food insecurity and would need food at that time. And we had a 3% response rate within a very short time from that pool of people that they actually needed food. And so this information then was redirected to the hospital, and then they went and delivered food to those people. And those are the types of things, like very practical experiences. I would say in the rural population, we've been seeing very high engagement through text. So when we're sending information through the SMS channel in rural Oregon, with some of our messages, we're getting as high as a 10% click-through rate. And this is in a context where your click-through rates for general content industry-wide might look like 2%, right? So this is an indicator to us about a high level of engagement, even in rural areas, to content in the COVID situation.
Well, that's really interesting, and it's really cool to see that increase and that hunger for information through a trusted source. So how can hospitals utilize texting or partner with Access Mobile to sort of help their communities during this pandemic and even after?
Right. So I think there's a number of types of information that we see patients being very engaged around. So obviously with services starting to resume incrementally across the country, for people that have regular care needs who were not able to access those needs during COVID, or who were not comfortable to go into a hospital setting during COVID for those services, this is a time now when those populations are starting to understand what's next, right? And so it becomes really critical for providers to communicate efficiently and clearly to different patient populations that have regular care needs about what they should expect going forward. And SMS and using the mobile channel is a very effective way to do that. I think also we find that, when we're partnering with groups, that when it comes to other SDOH services, because so many people are struggling right now, that those hospitals are trying to deliver to their patients, understanding there's broader needs outside of the clinical care. Linkages to services and care are very effective in terms of understanding who has what needs where efficiently through texting. And so we're partnering with groups, and we see opportunities to partner to use the mobile channel to build those bridges. And I think ultimately we know that in this next phase, hospitals are going to be trying to figure out how to balance both the response to COVID and other regular care. So any content around that domain we find is a critical area of importance to partner on and understand not only that, but what types of communication people will really respond to. And so there's many opportunities that we see to partner, not just on the messaging, but really thinking more holistically about people's care needs and how we communicate to them in a COVID context.
So you're right in the thick of things dealing with COVID. How do you think that COVID is really changing our conversation and our movement towards value and the use of greater mobile technology in the future?
Right. So I think that, there's been so much conversation about the use of digital tools and digital health in the COVID context, because people have been staying at home but have still needed to connect to their healthcare providers or to other types of information. And so I think many people are seeing that digital health and the expansion of use of tools is really, here to stay, whether it's, we're looking at telemedicine or it's remote diagnostics. So we're thinking more carefully about when people actually need to come into a care setting and not, and then more broadly, patient engagement. All these areas are linked also to how we think about value, right? How do we think about the use of digital tools, and not just the use of the tools for the sake of the technology, but really mapping the use of those tools to people's care needs and specific outcomes. And I think that's what I think COVID is forcing providers and other innovators in the digital health space to do, is to build that closer bridge between value and digital innovation. But I think there's a second stream that of the conversation that's just starting, and it's and it's something that's been around for a while, which is about health disparities. So health disparities are nothing new, And, unfortunately, we're seeing through COVID-19 just how stark those health disparities are for our African Americans and other populations in terms of the differential impact of COVID, in terms of both morbidity and mortality. But the extension of that into digital health is, what does digital health mean in a disparities context? So is it indeed true that all populations in the country will have access to digital innovations? Or can digital innovations, if they're just available to those who already have access, rather deepen the divide? And so I think that there's another conversation that, should, and I assume will start, about ensuring that as we look at disparities in digital innovation, that everybody is participating and gaining. Otherwise, the digital innovation will just be supporting those that already have access.
Right. And I know that we are looking forward to continuing that conversation with you around the digital divide and healthcare disparities as we move into the future. KP, thank you again for joining me today to sort of broaden out our conversation and talk about using digital tools and especially text messaging during this time of COVID-19 and where we go next after. So thank you again, and we're looking forward to keeping our conversation going.
Thanks so much, Priya. We appreciate the opportunity.
To learn more about Access Mobile, listen to Priya Bathija's and Kaakpema Yelpaala's first podcast, titled Using Technology to Improve Health Outcomes.